Good evening to everyone, and I want to thank you again for coming to view this presentation. I do encourage you to ask as many questions as you like about the vaccine, because we know that there's been a lot of news around it recently, especially with the expansion of eligibility, boosters, and third doses, and so forth. So with that said, I just want to begin with a disclaimer. Information about COVID-19 and vaccination changes frequently, but this presentation was current as of November 9th, and it only includes information, which is to say that we're going to focus today on Pfizer, Moderna, and Johnson & Johnson, referring only to the Pfizer vaccine. Our presentation today will cover COVID-19 and vaccine basics, how vaccines work, development, safety, and side effects, vaccines for children age 5 and over, allergies, how to get vaccinated, and what's going to happen after you're fully vaccinated, and most importantly, your questions and concerns. So here's what we know about COVID-19. COVID-19 is caused by a virus called SARS-CoV-2. The virus can affect people in different ways, where some people will never get symptoms, some people get mild or moderate symptoms, and others get severe illness, especially older adults and people with certain medical conditions. The types of symptoms also varies, but people can pass the virus on to others even if they don't have symptoms. And as mentioned before, there are 3 vaccines for COVID-19 that are available in the United States. First one is Pfizer, and this is now open to people who are age 5 and over. It is what's known as an mRNA vaccine, and in the initial series, it's given in 2 doses taken 21 days apart. The other mRNA vaccine is made by Moderna, and this is strictly for people who are 18 and over. It's administered in 2 doses in the initial series and given 28 days apart. The Johnson & Johnson or Janssen vaccine is another vaccine that is available only to people who are age 18 and over. And this is a DNA or viral vector vaccine. So it's made using a different technology, but it accomplishes the same thing in providing immunity to COVID-19. And in the initial series, it is given as 1 dose. Now, COVID-19 vaccination is important, especially to protect you. It's the best way to prevent COVID-19. And the vaccines are extremely good at preventing people from getting sick from COVID-19 and ending up in the hospital or dying. They can also prevent you from missing work and school. And COVID-19 vaccines also reduce the risk of becoming chronically ill from COVID-19 or getting what is known as long COVID. Getting vaccinated is also a safer way to build protection than natural immunity. So if you get COVID-19, you can get very sick, or you can give it to someone else who could get very sick. And even people who have had COVID-19, even though they've had COVID-19, they should still get vaccinated because their natural immunity may not last as long or be strong enough, and you can always get infected again. Okay. So when we get vaccinated, we're not just protecting ourselves, but also our family, our friends, and our neighbors. And this includes people who are not yet fully vaccinated, such as children under 5 who cannot be vaccinated yet. This also includes those at a higher risk of getting severe disease if they get infected, such as older adults and those with certain medical conditions. People who have conditions such as heart disease or diabetes, or who have a weakened immune system due to cancer. These folks are at a high risk of becoming very ill and even dying from COVID-19. However, the more people get vaccinated, the less likely it is that COVID-19 will spread or that new variants of the virus will take hold. So you can do your part to help stop the pandemic by getting vaccinated. And as I mentioned before, it is recommended that you get vaccinated even if you have already had COVID-19. We don't yet know how long you're protected after you've had COVID-19, but we do know that protection does wane over time. It's a natural process. You can get COVID-19 more than once, and getting vaccinated will boost your immunity for better and longer protection against COVID-19, including more infectious variants of the virus. It is safe to get the vaccine after getting COVID-19, but you should definitely wait until after your isolation period is over. And this is just so that you don't infect healthcare workers and others when you do go to get vaccinated. If you've had a monoclonal antibody treatment for COVID-19 infection, you should wait for 90 days before getting the COVID-19 vaccine. And also, if you have had monoclonal antibodies as pre-exposure prophylaxis to prevent COVID, you only need to wait 30 days before getting vaccinated. And as I mentioned before, we're just learning about long COVID, and some people suffer from new or ongoing symptoms for weeks or months after getting infected with COVID-19, and this is known as long COVID or post-COVID. And this can occur in people who've had no symptoms or mild symptoms when they were infected. And some of the symptoms that have been reported include tiredness, headache, joint or muscle pain, respiratory problems, difficulty thinking, and mood or sleep disorders. So these are very serious symptoms that can last for a long range of time, even after your infection has passed. Now, the LA County Department of Public Health is tracking variants, and what we found is that the Delta variant is causing 100% of the infections in LA County and the vast majority of infections worldwide. Like all viruses, SARS-CoV-2, which is the virus that causes COVID-19, changes constantly through mutation. And when a virus differs by one or more mutations from other circulating viruses, that virus is described as a variant. The more transmission there is of the virus, the more mutations there will be. And some of these mutations will end up being variants of concern that are more infectious and in some cases more deadly. So where there are pockets of unvaccinated individuals, these variants can proliferate. Okay. However, vaccination can prevent this by lowering the chance of getting sick from COVID-19, by lowering the chance of being hospitalized, and preventing the spread to others. So let's review how COVID-19 vaccines work. COVID-19 vaccines prepare our immune system to recognize and fight off germs. All three COVID-19 vaccines teach our cells to make harmless spike proteins, which are the crown-like spikes on the surface of the COVID-19 virus. And in this picture here, you'll see them illustrated in these red spikes right there. And these do not harm our cells. When we are vaccinated, the spike proteins show on the surfaces of our cells, and our immune system sees them and know that they don't belong there. So our immune system will respond by making antibodies. These antibodies prepare our immune cells to respond to future infection, so that if we ever get the COVID-19 virus, our immune system recognizes it by the spike proteins. And this is what makes a vaccine so effective. Instead of treating the disease after it happens, vaccines can prevent us from getting sick in the first place. And as I mentioned previously, we're going to focus on the mRNA COVID-19 vaccine because that's the type of vaccine that Pfizer is making. So messenger RNA or mRNA is genetic material that tells your body how to make those proteins. Our bodies use mRNA to make proteins all the time. The vaccine is made of mRNA wrapped in oily bubbles, also known as lipid nanoparticles or LNPs, and these allow the mRNA to enter your cells and protects the mRNA. The mRNA then teaches your cells how to make copies of that spike protein. So in this illustration here, The lipid nanoparticles are shown in the gray circle with the mRNA. Here's this blue squiggle. And the bubbles or the lipid nanoparticles deliver the mRNA, and that's when it codes for the spike proteins, which are then going to be secreted onto the surface of the cell. And it's these spike proteins that your immune system responds to in order to build immunity. Now let's talk about vaccine development, safety, and side effects. Okay, so the mRNA vaccines use technology that has already been in existence for 20 years. However, mRNA vaccines have been studied for other illnesses such as influenza, Zika, and rabies. Now, typically, developing a new vaccine usually takes years, but in the case of COVID, scientists had a head start because they had already studied other coronaviruses, and they've already studied both mRNA and viral vector vaccines. The government also invested a lot of funding to pay companies and scientists to work around the clock, and researchers used existing networks to conduct COVID-19 vaccine trials. The most important thing to take away from this is that every step that is required to make sure that a vaccine is safe and effective was followed. Okay, so it was just expedited because of the pandemic. When it comes to manufacturing and authorization, we began manufacturing while the clinical trials were still underway. And the thing is that mRNA vaccines are faster to produce than traditional vaccines. The FDA and CDC also prioritize the review and authorization of COVID-19 vaccines. So again, COVID-19 vaccines are being held to the same safety standards as all other vaccines. And to reiterate, safety of COVID-19 vaccines is a top priority. So before authorization, the safety data was reviewed by independent medical and public health experts, and they made recommendations to the Food and Drug Administration, or the FDA, and the Centers for Disease Control and Prevention, or the CDC. These are the top two agencies in the US, the top experts that guide our scientific knowledge here in the United States. The FDA issues the emergency use authorization and allows use only when the expected benefits outweigh the potential risks. And after authorization, after any vaccines are authorized and in use, both the FDA and CDC continue to monitor the safety of vaccines. Monitoring happens with all vaccines, even years after they were launched. So in this case, all the usual monitoring will happen for COVID-19 vaccines, plus additional ones. One of the new methods is called Be Safe, which is actually a smartphone app. A person who gets a vaccine signs up, and then they get a text message, check-in from the CDC. It'll happen daily for 1 week. Weekly through 6 weeks, then at 3, 6, and 12 months. And if a person reports any of the concerns, they will get a call and a safety report is filed. Now, with regard to the studies of the COVID-19 vaccines, I think it's worth noting that COVID-19 vaccines have been widely given now for almost a full year, and even longer than that for those who were involved in the original clinical trials. So, just keep in mind that we have nearly a year of real world experience. However, in the clinical trials, there were still tens of thousands of volunteers. It was done in a diverse mix of people, including older adults, people with underlying health conditions, and people of color. And because this was a clinical trial, half got the vaccine, half got placebo or salt water, but all three of the vaccines were found to work very well and to be safe. And again, since December 2020, hundreds of millions of people in the US have safely received a COVID-19 vaccine. Now, every vaccine has side effects. For example, after getting the COVID-19 vaccine, you may have some side effects like the ones you get after a flu or the shingles vaccine. For 2-dose vaccines, side effects are more common after the second dose. And these side effects may limit your ability to do daily activities, but they should go away within a day or two. And it's also important to remember that not everyone will get side effects, but some of those side effects may include arm pain, redness, or swelling. That's something that I personally experienced. Fever, chills, muscle aches, headache, feeling tired, nausea. These side effects are going to be normal, and they're a sign that the vaccine is working. It shows that your body is learning to fight the virus and is building immunity. So it's important to get the second dose, even if you get those side effects after the first dose, unless a vaccination provider or a doctor tells you not to. Now, there may be times when you're concerned about your side effects, and it would be important to contact your doctor. And it would be important to contact your doctor in the following circumstances. One is if your side effects last more than 2 days, if symptoms start more than 2 days after you got the vaccine, and if you get any of the symptoms such as cough, shortness of breath, runny nose, sore throat, or new loss of taste or smell, this may be a COVID infection. So definitely go and get tested and call your doctor. And of course, if your symptoms get worse or worry you and you're experiencing some serious side effects, definitely contact your doctor. Now, I would like to address a couple of serious side effects, but with the caveat that these are extremely rare. Now, anaphylaxis is one serious side effect that may accompany many vaccines and medicines. It can entail a severe allergic reaction, which usually happens within the first 15 to 30 minutes, but vaccination providers can treat this straight away. This is why after people are vaccinated, they are under observation by a medical professional for 15 to 30 minutes so that they can catch any of those adverse reactions. Myocarditis and pericarditis are common after the Pfizer and Moderna vaccines. Inflammation of the heart muscle is known as myocarditis, or the outer lining of the heart, and the outer lining of the heart is pericarditis. And these have been seen in people who received the Pfizer and Moderna vaccines. Most of the cases were reported in male adolescents and young adults days after the second dose of the vaccine. But most people who received care improved with medicine and rest and felt better quickly. People who experience these conditions can usually return to their normal daily activities after their symptoms and improve. But it's also really important to note that myocarditis and pericarditis are actually more common in people who get COVID-19. And the risk to the heart from COVID-19 infection can be a lot more severe than myocarditis or pericarditis that they might experience if they were to get vaccinated. So, that's an important point where you need to weigh the costs and benefits here, where the risk of not being vaccinated with the COVID-19 is much higher. People who do not, and people who are vaccinated with the COVID-19 and they get myocarditis, those risks are much lower than those who get it through COVID-19 infection. Hope that makes sense. Okay, so you should learn about possible symptoms to look out for and know when to get medical help, because we have a lot of information on our website called vaccinatelacounty.com. And here's a nice statistic for you. Over 423 million doses of COVID-19 vaccine have been given in the US. And although the side effects may happen, they are very, very rare. So again, just keep in mind that the benefits of getting vaccinated far outweigh the risk. So now let's talk about how to get vaccinated. So the vaccine, as you know, is now available to everyone age 5 and over. And again, people who are 5 to 17 years old can only get the Pfizer vaccine. The vaccine is free for everyone, and insurance is not required. Anyone can get the vaccine regardless of immigration status. And getting a COVID-19 vaccine will not is open to everyone. You can do walk-ins, and you don't necessarily have to make an appointment. So they should be very easy to access. And there are hundreds of locations throughout LA County, including LA County and LA City run sites, pharmacies, pediatricians' offices, health centers, hospitals and schools, mobile and pop-up sites in your community, workplaces, places of worship, metro stations, parks, events, senior housing developments and long-term care facilities. And as several of you might know, Tzu Chi is also setting up a few clinics at school districts. So it'll be a great opportunity to go ahead and get your vaccines at that time. We also have other ways to find out a location to get vaccinated. Again, if you go to vaccinatelacounty.com, you can just click on how to get vaccinated and enter a zip code to find a location near you. Many sites are open on the weekends and evenings. Again, no appointment may be needed at many locations. And we also have free transportation and information on paratransit services that we can provide you with. If you don't have access to the internet or know someone who doesn't, we do have a hotline that you can call. It's our Department of Public Health Vaccine Call Center, which you can reach here at this number, 833-540-0473. And the hours are 8 a.m. to 8:30 p.m. And they can also help you set up an appointment and arrange for transportation. Now, COVID-19 vaccines can be given at the same time as many other vaccines. So if you or your child are behind on routinely recommended vaccines, now is a good time to work with your doctor to get caught up. The COVID-19 vaccine can be given at the same time as the flu vaccine. We do recommend a flu shot for everyone 6 months old and over. So you can visit preventflula.com for more information on the flu vaccine and where to get it. Again, many places are offering the flu and COVID vaccines at their site. Now, when you get vaccinated, you will be receiving a white vaccination card that's issued by the CDC. It'll have the CDC logo on it, but it'll have the dates that you received your vaccine and what type of doses you got and what brand was given. So everyone is going to receive one when they are vaccinated, and it's very important that you keep it safe. Take a photo or make a copy of it. If you'd like one to store on your phone, you can get a digital vaccine record by going to myvaccinerecord.cdph.ca.gov. And always keep in mind that vaccine records are free. You will not be charged for any vaccine record. If you are, it is a scam. I also want to touch really quick on some vaccine mandates that we have in effect. You know, as you might know, LA County has a few vaccination mandates. So, you know, having that digital or photo vaccination record will be really useful if you're going to certain settings, such as the indoor portions of bars, wineries, breweries, nightclubs, and lounges. If you're attending an outdoor mega event, which is an event that has 10,000 or more people, and same also applies for indoor events with 1,000 or more people. And the city of Los Angeles also just issued a requirement that you will need to be vaccinated in order to enter places such as gyms, restaurants, shopping centers, spas, and hair salons, all city facilities, and seniors and recreation centers. So those are just some things to keep in mind and why you should definitely keep a record of your vaccination. So now let's focus on vaccines for children age 5 and up. So children ages 5 and over can get a Pfizer vaccine. Adolescents ages 12 and over get the same Pfizer vaccine as adults, and children ages 5 to 11 years old get a Pfizer vaccine made for their age group. It has the same active ingredient, but is a smaller dose. It's a third of the dose than the regular Pfizer vaccine, and it's given with a smaller needle. However, both versions of the vaccine are given as 2 doses taken 21 days apart. It's important to get the second dose to get the full protection from the vaccine. And your child will be considered fully vaccinated 2 weeks after they get the second dose. Also, keep in mind that the Moderna and Johnson & Johnson vaccines are not available for children under 18 years of age. Both these vaccines are currently only authorized for people 18 and older. Okay, so you only want to look for a vaccination site that offers Pfizer. Now, vaccination is also the best way to protect children from COVID-19. Over 4 million children have tested positive for COVID-19 in the US since the start of the pandemic. Even though COVID-19 is milder in children than adults, some children can get very sick or have lasting health problems from COVID-19. The vaccine will also protect against multisystem inflammatory syndrome in children, also known as MIS-C. It's a rare but serious condition in young people who have had COVID-19. Getting your child vaccinated lowers their risk of getting infected with the virus that causes COVID-19. Additionally, some children who get infected can also have long-term health complications. Again, this is called long COVID. Children with long COVID may feel tired, they can get headaches, have trouble focusing, and this can last for weeks to months after getting COVID-19. There is no way to tell in advance if a children will get a severe case of COVID-19 or if they will get long COVID. And once your child is fully vaccinated, it will be safer for them to take part in regular activities. Hanging out with friends, going to school without disruption, playing sports, and traveling to see family will be safer. They won't be required to test to play certain sports or to go to large events. And they also won't need to quarantine if they are exposed to COVID-19 if they do not have symptoms. This includes being exposed at school, home, while playing organized sports, or after travel. Getting your child vaccinated also helps to protect family and friends. And this is especially helpful for protecting people who are not vaccinated, such as children under 5, and those who are at higher risk of getting really sick if they get infected, such as older adults and those with certain medical conditions. Okay. And again, the COVID-19 Pfizer vaccine has been found to be very safe and effective. There's no evidence that it affects development or fertility, and serious health events are rare, but they can be treated. As mentioned before, with severe allergic reactions or anaphylaxis, this is something that can happen after any vaccination, but it can be treated right away. Also, inflammation of the heart or myocarditis and pericarditis are conditions that can be treated, and their cases are very rare and usually very mild. More than 11 million 12 to 17-year-olds have already safely received the vaccine. And again, the side effects that children may experience are going to be similar to what adults do. And this includes sore red arm, feeling tired, headache, muscle, fever, chills. These side effects may, again, limit your daily activities, but they should go away in a couple days. And not everyone will get them. These side effects are normal, and it's a sign that the body is building immunity. So if you have questions about any of this, please do speak with your pediatrician. Also like to note that most people with allergies can get a vaccine. So the COVID-19 vaccines do not contain eggs, gelatin, latex, or preservatives. And the small risk of severe allergic reaction, there's a small risk of severe allergic reaction with any vaccine. But do talk to your doctor if you've had an allergic reaction to any vaccine, an injectable therapy, polyethylene glycol, or polysorbate. People who are allergic to other things like oral medication, food, pets, or pollen or have had a family history of allergies can be vaccinated. But again, everyone is going to be observed for allergic reactions after getting the COVID-19 vaccine for about 15 to 30 minutes. And again, information may change, so go ahead and check the latest guidance through the CDC at this website here. And of course, talk to your doctor if you have any concerns about your specific condition. So now let's talk about what happens after you're fully vaccinated. So people are considered fully vaccinated 2 weeks after their second dose in a 2-dose series. Okay, so this is 2 weeks after you receive the second dose of Pfizer or Moderna. If it has been less than 2 weeks since your shot, or you still need to get your second dose, you are not fully protected. And you're also considered to be not fully vaccinated. It's also important that you do try to get reliable information. I know that there's a lot of information out there, and we know that you want to make the best choice possible, and we're here to help you, and that's why we are here today to answer your questions. And then, of course, we also direct you to our website, vaccinatelacounty.com. We also have it in Spanish at vacunatelosangeles.com. Where you can find an abundance of information about the vaccines. Now, given that there's still considerable transmission, along with the risk that changing conditions favor easier spread of COVID as more activities move indoors and people travel and gather to celebrate the holidays, it remains important for us to maintain additional layers of protection, including masking up indoors and in crowded spaces. This is also the time before the holidays and before cooler weather leads to a rise in viral transmission for unvaccinated people to get their vaccines and those eligible for boosters to get their additional dose. So we have many layers of protection as we head into the holidays. And, just as a reminder, the vaccine is one and a very powerful tool in our toolkit in this pandemic. We want to wear masks, wash our hands, remember to stay home when you're sick, avoid crowded places and spaces with limited ventilation, and also keep your distance when you're around others. In summary, we have excellent vaccines that are safe and effective. If you get exposed to COVID-19, all vaccines can prevent you from getting sick, missing work, or ending up in the hospital. Vaccines are now available to everyone ages 5 and over, and there are many different sites across the county to make it as easy as possible to get vaccinated. Vaccines protect us, our families, our coworkers, and our communities. And so with that said, I would like to move into our question portion of this evening.